I'm really driven by the fact that people don't have a voice necessarily in their health. They just accept what they're given.
There is something inherent about the system that people are expected to go along with that doesn't work for a lot of people.
There are so many factors that are against people, things that are out of their control, the housing they've got, the education they're given.
I would like to be able to help to change the systems that don't work for people.
Community organisations are great in the sense that they are really closely, well embedded in their communities, and they're obviously interacting with residents on a regular basis.
When you're working within a community, you understand the community, and if you've been working with them for years, you build up a trust, and then people want to access services and programmes and initiatives that you're running.
What we find with those activities is that it does bring people together. There's friendship groups that come out of it, and it does sort of escalate into something that becomes more than the activity, if you like.
We're able to give people a voice on a local level because we're here and we're trusted, and people are willing to talk to us about what they really need.
I was particularly interested in wanting to address issues about healthy eating. When I meet up with the kids, they'll talk to me about, how they feel about their health and whether they are concerned about issues like that. I can't make a big difference to their lives, but I can make a small difference to their lives, and that's what I hope I've achieved.
I was introduced to this place by my friend when I was really struggling, and they helped me with meals. So I decided to ask if I could volunteer to kind of pay it forward a little bit, and I love it. It makes us feel better that we know someone's getting a hot dinner.
It's important for us to be part of the South Bristol Locality Partnership. I think working with other organisations in the area and also realising what the needs are of the area on a higher level has been really good to make sure that we target those areas so we can help and assist.
In terms of health inequalities, reducing them, it's not something you can do as a standalone organisation. You really have to work closely with others to bring about the collective change you're looking for.
This opportunity, I think, gives us the chance to look at how we can prevent people from getting ill in the first place, which would then reduce the demand on the health and social care system.
And the real issue that I'm concerned about is sustainability. You can't have monies that, last 3 or 6 months because you can't plan anything.
We don't need short, sharp bursts of funding. We need serious investment.
I think it's about shifting that focus into prevention more so that those kind of preventative approaches within community can be sustained and are treated as a kind of main source of care for people as opposed to kind of a secondary thought.
I love it. It makes me feel really good, like being able to help people and, give people a voice.